Some things that you may not know about Alzheimer's disease. This is Dr. George Moricz with Alzheimer's Treatment Centers of America. We've all heard of plaque being accumulated in the brain, amyloid beta plaque. Well, imagine you've gunked up the brain, okay? That's what we're looking at on imaging scans. That's what a lot of the newer medicines are trying to remove from the body. Think of it as sludge. Your brain tries to detoxify when you get into deep sleep. So what do we know about this plaque? Let's just call it plaque. Well, most people, when they have the amyloid beta, it's higher in the daytime and lower at night. Why is that? Well, soon you will find that lack of deep sleep, the inability to go into that deep, detoxifying type sleep where you basically flush all the toxins out of your brain, not having that sets you up for many illnesses, including dementia, including Alzheimer's. So when you go to bed at night, you must get into deep sleep. And one of the modalities that we look at is getting people into deep sleep, deep restorative sleep. Now, this is very different than a lot of sedative drugs, which a lot of people take earlier in their years, even before they're elderly. Those sedatives actually set you up for Alzheimer's. Remember, most of those drugs for sleep don't get you into deep sleep. When you get into deep sleep, you detoxify, you consolidate memories. Kind of makes sense to people. You're losing memories, you're accumulating plaque. So you may find out in the next year or two that cracking the code on deep restorative sleep is the key to tackling Alzheimer's disease. Using AI, let's stop the decline. Alzheimer's Treatment Centers of America. This is Dr. George Moricz.